Registration is online at runningguru.com. Search Sassy. The Tortoise and Hare Run, Saturday, April 5th. 10 minutes past 8 o'clock. It is Thursday morning, the 27th day of March, 2025. Good morning, everybody. I'm Scott Micklin. Thanks for tuning in to KSJE 90.9 FM over the air this morning in San Juan County, New Mexico. In Durango, Colorado, we're on the air at 103.3 FM. And if you're listening anywhere else on the planet, you've gone to our website to listen, streaming all the time from KSJE.com. Welcome also to our viewers who are joining us this morning. The video of this program is streaming out live to the KSJE Facebook page and also to our YouTube channel. So welcome aboard, everyone. So glad that you're with me this morning, because this morning we are getting an update. We will later on this morning, but right now we're going to get an update from the San Juan County Partnership. That is the first program that we're bringing you this morning, an update from the San Juan County Partnership, and then later on this morning we'll be checking in with Alan Elmore about his annual or biannual spring cleanup of Chokecherry Canyon. He'll bring us details about that at 8:50 a.m. this morning on KSJE. Next, of course, Big Hess takes us roving with the arts, our weekday classical music program. And a reminder, you can also connect with KSJE on X and Instagram, in addition to Facebook and YouTube. And if you're a podcast listener, we remind you that you can subscribe for free and check out KSJE podcasts. They're available wherever you listen to podcasts, and maybe discover a new local program that you may have missed recently. Outside our studios here at San Juan College, it is a partly cloudy Thursday morning, 45 degrees at the moment. We're expecting some increasing sunshine today with a high of 73 by this afternoon. Clear skies overnight, the low 44. Tomorrow cooler and windy with a high of 67 on Friday. 43 for an overnight low. Then for the weekend, mostly cloudy skies on Saturday and Sunday with highs each day near 60 degrees. Back with my guests with more right after this on KSJE. KSJE is supported by San Juan Regional Medical Center, whose vision is to deliver world-class care, making life better for the communities they are privileged to serve. Offering a comprehensive range of inpatient, outpatient, and emergency care services so residents can live life better here. San Juan Regional Medical Center, community-owned and operated, here for you.
Life is all about getting from one place to another, from home to work, between school and the store. But what if you don't know exactly how to get there? That's where the Navigation Center can help. Maybe you've lost vital documents, need help with housing, or can't find a medical provider. Located inside Presbyterian Medical Services at 1001 West Broadway, the Navigation Center can help you navigate life's challenges. The San Juan County Navigation Center, connecting to resources, empowering lives. Back in Studio A this morning with my guests, as I mentioned, from the San Juan County Partnership. Executive Director Anna Krutsky is here with me this morning. Good morning. Welcome back to KSJE. Nice to have you here.
Good morning. It's great to be here.
Thank you. And also joining us this morning, Julie Smith is here as well. Good morning to you from the Partnership.
Good morning, Scott.
Good to have you here as well, both of you. And so we will get started. Anna, you've got a lot of things coming up. In fact, something coming up today.
Absolutely.
An event that we want to talk about, right?
Yeah.
So should we start there?
Sure.
Okay. All right.
Yeah. This afternoon at our offices between 3 and 5, we are going to be hosting a community listening session.
Right.
Which is set up by UNM. They're doing some research on upstream approaches to violence and injury prevention, and so Farmington is on their list of communities to speak with.
Okay.
So it is open to anybody who wants to come. I can probably take only 30 people right now. I have 10 definitively
who
are going to become.
For more.
So we do have room for more. There will be snacks.
Okay.
Because that's the most important part
right.
of any event. Anyway, UNM is going to have a facilitator facilitator there, and they're going to walk us through some questions and try to help us understand the core injury prevention program, and then ask the community what they think would be good approaches from an upstream perspective of what's working to prevent some of the injury, what we need to be working on, and they are going to put that into a 5-year strategic plan that they're then going to give to the Department of Health for the state of New Mexico to work towards reducing some of the injury and violence that is a concern across the state.
Okay, got you. And they're doing this across the state too, these listening sessions,
Correct.
including Farmington, right?
Correct.
Okay.
Yes. And they just approached us
Sure.
a couple of weeks ago, and I said, sure, I'd be happy to facilitate that and have you come and talk to folks. So
Right.
we're looking forward
Well,
to
prevention is in your name, so I would hope they would reach
Exactly.
out to the San Juan County Partnership that deals with prevention and,
Exactly.
and works with all these things. And so talk to me a bit about maybe who should come. What types of individuals would you like at this listening session? Folks that have maybe had injury in their lives or
Possibly.
violent incidents, or what do you think?
Yeah, I think a lot of people who also work with folks
Okay.
who have had experiences or who are in the field working directly with the population who may have experienced violence. So law enforcement, and we do have several law enforcement folks who will be attending.
Good.
Social workers, people in the field, anybody working the front lines. Medical staff would be great to have there, people from the emergency room. So folks of that nature who have an understanding of what they're seeing and maybe have started to work on some of the issues, like us in the prevention realm around substance use prevention.
Got you. But it's that type of situation that you are talking about, correct? It's not like
Correct.
if I fell in my house and I'm injured. That's not what we're talking about.
No, not
Yeah.
necessarily, because that's really at the bottom of the list.
Right.
When we've looked at some of the data,
This is more societal.
well, yes, there is a societal element. Yeah, I guess that would be
Okay.
a good way to put it. When we look at the list, it's 57% of all injury deaths are related to drug and alcohol usage. So that may be through car accidents. Actually, 46% is car accidents. The 57% is, number 57, I think, total. This is, I start using percentages and not the exact numbers.
That's all right.
Sorry about that.
That's okay.
So I will edit that a little. 57 total people have died of overdose deaths. Most of that is in polysubstance use.
Got you. And these are local numbers that
These
you're...
are San Juan County data.
Okay.
Specific
From
numbers.
From your collection.
From our collection.
Right, that you all
exactly.
do. Right, and track some of these things. So
Exactly.
got it. And so with that being said, then with this listening session, as you mentioned, this is from UNM, and they're going around the state to try to gather some of this information, and then we'll, I guess, combine it all and maybe present something maybe to the state and to the department to try to get some targeted funding to deal with these issues in these communities?
Exactly. So looking at specific strategies, what are some strategies that we can utilize before people get to a place of hurting themselves in any capacity or being hurt?
And that's
by
where that
others?
term upstream comes into play, correct?
Exactly.
Okay.
Really important
Not
term.
that we're at the San Juan River and we're, a little bit different than
Okay,
that.
so if you're going to go on the San Juan River,
Right.
make sure you
Yeah.
are with somebody who knows what they're doing. Wear a helmet if you're
There
in
you
a raft.
go. Yes, all those things. But-
All those things, but that is actually a significant component.
Mm-hmm.
You know, we're looking at safety. You know, how do we help people be safest?
Sure.
You know, across the board. You know, and how can we increase those prevention factors? You know, to increase safety measures so we reduce the episodes or incidents of injury or death.
Right. And we know, I think, too, from studying this population, when there's abuse and addiction and things like that, it's a pretty violent lifestyle in some cases. I don't want to say everybody, but I think that's a pretty violent existence for some people who are in that world.
Well, when you are mixing multiple substances, alcohol, methamphetamine, fentanyl, your risks of dying of overdose increased significantly. And so that is still a really big issue that we are looking at across the state, in our community, and across the country.
Right, right. Very true. Julie, I wanted to bring you into the conversation too a little bit. Sorry to keep you out of it. Didn't mean to. But if you've got something to add, I wanted to ask you too about your thoughts about listening to folks and their experiences and providing some of this information to these researchers from UNM.
Yeah, it's important for when we're doing research like this for people to get all of the perspectives that they can and be able to get that data in a really meaningful way. So, we have two different types of data, quantitative and qualitative. So this is that qualitative piece. We're listening to people, we're getting the information directly from people who are working in fields where they see these types of injuries. They see people who are being hurt and are hurting people. So getting the kind of information from them directly is super important in these kinds of research endeavors.
Right, that firsthand accounts, I guess, right?
Yes.
Of what we're seeing in our community, which may be different from what is seen in Santa Fe or Las Cruces or Gallup, who knows, right?
Absolutely.
And that's the idea of traveling around the state to gather and talk and
Exactly,
listen,
right.
not talking, listening
Right.
to these folks.
Right.
Yes.
So one of the things that's working is the work that Julie is doing in the community, talking with youth about alcohol, cannabis, or vaping concerns with school age kiddos. And with that group, if we can give them the information and educate them enough so we reduce the early onset of substance use, and we educate them about safety specific issues around, say, alcohol, then we are doing upstream work to reduce these incidents. And we are starting to see a trend in a reduction in youth alcohol use in early age,
Right.
and with overdose deaths or drinking and driving with youth. So we are starting to see those numbers starting to trend down.
Nice.
So it's working, and that's some of what we're going to be talking about this evening as well.
That's
What's
exciting.
working, and how can we continue to support those efforts?
Right, and I remember, at least with the youth numbers, our conversation with Julie about some of these things from the research and the programs that you are doing, and that's coming out and seeing that in the data that you collect.
Correct. Yes.
And so a lot of this too, I want to talk again about this upstream idea, is pretty data driven, right? If we can help solve or reduce the problem before it gets serious, I guess, or someone gets seriously hurt or injured or addicted or what have you, it certainly saves everybody a lot of effort, time, resources down the road. Is that part of the idea too?
Absolutely. Yeah, the more information we have and the more details we have, the more we can figure out exactly what we need to target, and where what are we missing and what do we need to focus on and what's working.
Right, right. And again, you're seeing that. We're seeing trends
We
and
are.
decreases in some of these things that are going in the right direction.
Right. So San Juan County Partnership has been focusing specifically on reducing youth early use for over 30 years now, and so that those efforts are starting to pay off.
Right, right. Excellent, which is important. And so,
Yeah,
very
and
good.
it is a long-term process.
Right, very
It
true.
doesn't happen overnight.
No, as we've seen, but the needle is moving in the right
needle
direction.
is moving in the right direction.
And so that's good to know. And so again, this community listening session happening today, this afternoon, about 3 o'clock, 3
Correct.
to 5.
3 o'clock, yes.
At the San Juan County Partnership offices there at 1515 East 20th Street in Suite B. If you're listening on the radio and can't see the poster we have on the screen right now, that is what we are talking about this morning, at least for now, but we've got other things to talk about too. But it's an idea, individuals working on injury and violence prevention upstream factors are folks who should attend, and it's open really to everybody. You've got some extra spots at the moment.
I do.
So do you want them to RSVP or at least tell you they're planning to come, or just show up?
They can just show up. That
Okay.
would be absolutely fine.
Gotcha. Okay. Very good. And then what's the time frame, do you think? When do you think you'll hear back from UNM about what they're gathering around the state? I know it's taking probably some time to gather and listen.
I think that most of the listening sessions they were going to try to get completed in March and April across the state, and then I don't know how long it's going to take. I don't know what other data that they're using. This is, as Julie was talking about a minute ago, this is not the this is a focus session, a listening session is, Julie?
Qualitative.
Thank you.
Ah, yes, that
So
word.
sometimes
that
words
word.
just go away from
Right.
you. So
Gotcha.
this is qualitative data, you know, and they've collected, I do believe, most of the quantitative data already, and most of this data that we're looking at is from 2023. That is the most recent for injury and death data that we can access, and most of that information comes from community and or emergency room or hospitals.
Right.
And law enforcement.
Got you. And when they are here, just one final question about this topic, and we'll move on to something else. But when they are here, what are some of the things that you think makes our community somewhat unique as they travel around and are listening to these issues that are in all counties in New Mexico for sure? But what makes the situation here somewhat unique in San Juan County?
Absolutely. So I talk about this a lot. San Juan County is special. It is different in that we work together collaboratively with the resources that we have here in probably one of the most successful ways I've seen from talking to other people across the state. So our collective...
Especially in your line of work, I guess, right?
Yes, exactly. The collective collaboration around accessing resources, getting the people the help that they need, and identifying what's out there and not working in silos has been incredibly effective. And I think we're continuing to do an incredibly good job as municipalities and as a county and all of the resource providers with the hospital, with other service providers, with and nonprofit organizations across the county work pretty successfully, and that's what's different about us, and it really makes a significant difference, and it saves lives.
Right. And I think folks are usually surprised that when they come here maybe and learn about that, because it doesn't happen everywhere. And I think those of us that live here think it does, and they're surprised that it doesn't. And we're like, well, why can't you just talk to that guy over there and he can help you reach this goal that you're trying to get to?
Exactly.
And people don't always do that. And here we somewhat take it for granted, I think, if you're not really directly involved in some of these collaborations and partnerships and things like that are really helping to move that needle. I think that's also part of this, right?
It absolutely is a huge part of this.
Yeah.
And an important part.
Very good. Well,
Yeah.
good luck with it today. Again,
Thank
the
you.
listening session. I hope you get a full house, and the researchers and the folks coming up here will get a lot of data that they can take back and put together for their report on what they're trying to come up with. So, and keep us informed. Keep us
Sure
up to
will.
date. So,
I will.
Thank you very much. What else is going on at the San Juan County Partnership these days?
Well,
Julie?
we have a little bit of an announcement.
Okay.
One of our longtime colleagues, Douglas Joe, has retired.
Wow,
So
that's a big deal.
It is a big deal. Many people in the community know Doug from his work with people experiencing homelessness. He has been a huge advocate and a huge impact on that population. And he did finally decide to retire. So we are going to be hosting a huge retirement party for him next week, Thursday, April 3rd, from 12 to 3 at the Farmington Elks Lodge. So anybody who has worked with Doug is welcome to come and celebrate with him and bid him a very fond farewell from San Juan County Partnership.
Very nice. Very nice. How long was Douglas with the partnership?
I was just trying to figure this out the other day. 7 or 8 years. He's come and gone a couple of times, and he's been involved with several different projects, working with our AmeriCorps team, and now as the housing supervisor. So.
Right.
We're going to miss him.
Sure. Yeah, he did a lot of work with that program, I know, and was a guest here and talked about it with me numerous times. And I was always impressed because he would talk about maybe working with an individual or maybe a family, but maybe he found them housing, but maybe they needed some beds. And then he would go and on his own, I think, this is not part of his job, and not other duties as assigned, but would go and on his own find beds or furniture or whatever maybe this family would need for this new home.
Absolutely. I think one of the things that made Doug so special was that he would find everything that somebody would need to create a home, teach them how to use it. A lot of the people that we've housed who have been living on the streets didn't know necessarily how to utilize or, how to make a bed.
Yeah.
Some basics that we think of that we just know. a lot of these folks didn't know. So he would set them up, and he would make sure, like, we had a family, I want to say about 2 years ago, who didn't have a table and chairs. It was Thanksgiving. He found the tables and chairs, and he found them an entire Thanksgiving dinner and brought it to them. So this single mom with her kiddos was able to sit down at a table all together.
In her home.
In her home.
With her family.
With her family.
Amazing.
And have a full meal. And he supported that. So he has been just a gem in this community, and I'm really excited to celebrate him.
Right.
And I'm really excited to see what the next chapter is with our housing program.
Very true.
We've identified somebody who is going to try to fill that role, and I will wait on that.
Okay.
It's fairly new.
No announcement yet? No breaking news?
It'll be a slow announcement, and
Okay.
we will make that bigger within the next month.
Okay. Stay tuned is what we say.
Stay tuned
In the
for
radio
that.
business, so
Yes.
very true. Julie, any thoughts about
So
Douglas and his contributions to the partnership?
Doug was just a joy to work with, and worked with clients in a way that is really inspiring to others. And one of the things that Doug did so well, and I'm sure will continue to do well, because just because he's retired doesn't mean he's going to stop impacting our community,
Good
because
point.
that's just not him. One of the things that he did really well, as Anna mentioned, is find resources for people, because when you've been experiencing homelessness, you don't have anything. You don't carry around, like Anna said, a table and chairs or beds, or you might have a couple of changes of clothing, and you're lucky to have that. So when we find housing for someone, those other resources, those things that we just don't think about because we enjoy the privilege of having established homes, things like towels, a dish, sets of dishes,
Right.
anything like that. So this is going to be my plea to folks, that just because Doug is gone doesn't mean that need ends. So if there are folks out there that it's spring cleaning time, and if you're going through your shed or your storage unit or whatever, and you've got some of those extra things, be thinking about who could utilize those instead of maybe just throwing them away. Find some place to donate, so that people who don't have as much as others might be able to utilize those resources in a way that's really, really meaningful to them.
Good point. Very good point. And again, Douglas Joe, congratulations. Good luck to you, and we will celebrate with you next week. It sounds like it's going to be a great party.
Yes, and there will be food there too.
Well,
Yes.
of course.
If you feed them, they will come.
Yeah, we need to do that. Of course, that's wonderful. So, very good. And that is a really important program that the San Juan County Partnership operates. And I think you probably have more need than resources for the
Absolutely.
folks in this community.
There's always more need than resources. I am working right now to secure funding for our next fiscal year, which will start July 1st.
Right.
We do still have a little bit of funding for homeless prevention, so people who may be at risk of being evicted for late payment, we can support you, or the County Navigation Center can also support in getting you on a list with the state that creates a waiting list that we can look through to identify people who are in most need.
Gotcha. Good. I'm glad to know that program will continue.
Oh,
Just with new
absolutely.
leadership
It will continue.
and someone new at the helm.
Yes.
So that is good to know.
Yes.
So very good. Couple minutes remaining this morning with our time together. What else can we update folks on about the partnership?
I'll take it.
Okay.
Just a quick reminder to anybody who needs any kind of youth-focused substance use prevention education. I have several presentations that are ready to go, available. Vaping and tobacco, one on alcohol, and those both are for any ages. And then I have a cannabis prevention education presentation that is for high school and above. So if anybody out there, homeschool groups or 4-H, any other clubs, anybody who works with youth needs some kind of prevention education, please feel free to reach out to me at the partnership, and I'd be happy to come and talk to your kiddos.
Very good. And the age group you would think for these other programs that aren't necessarily based at the high school, but the younger kids?
For vaping and tobacco, we can't start young enough. Really? Seriously. It's an epidemic, and not just in our county. I recently attended a conference, and it's something that everybody's talking about. Vaping is starting younger and younger. They just don't understand how much it is like smoking and how dangerous it is for their small developing bodies and brains. And so I'll start at kindergarten.
Okay.
If they can spell their name, I will.
You will talk to them.
I will talk to them.
Okay.
Because if we start that prevention, this is that upstream piece, right? We start those prevention efforts early. We prevent, and then we don't have to deal with, treating or helping people to quit. If we prevent it, then it's prevented.
And I know you have taught me this, Julie Smith, about how this is so relatively new. We don't know a lot about the long-term health effects of vaping specifically. We know smoking for sure, but vaping, and we're finding out, it seems to me, that there's a lot of similarities in damage and health effects from vaping that we found in cigarettes. And I think a lot of folks thought, wrongly, that vaping was safer than cigarettes, and that doesn't appear to always be the case, correct?
It is not the case. When vaping came on the scene, it was introduced as a healthier alternative, and maybe a way to help people who were currently smoking cigarettes to quit cigarettes. And so, as with any brand new thing, medication, if you will, because it is a chemical. The nicotine in those vapes is a chemical, and it still affects the brain and the body the same way nicotine in cigarettes do. But it's also all of the other stuff that people are inhaling into their body from that aerosol, not vapor, aerosol that comes out of the vape, that people just don't understand the impact that that's going to have on their body long term. Now, we don't understand all of the long-term impacts, but we do know that some people are more susceptible to, they call it EVALI, e-cigarette or vaping-associated lung injury. And some people, just like some people, not everybody who smokes is going to get cancer, but the chances, if you do, are raised greatly. Same thing with EVALI. And that EVALI is very damaging to the lungs, damaging to where people who are experiencing this end up being on oxygen because there's just no way for their lungs to get enough oxygen into their body for it to function correctly. So as we study it more, as we get more data on vaping, it's not looking great.
Yeah.
It's not looking like it's a better alternative, especially for kids, especially for kids. We don't know the impacts of what all of these chemicals, all of these things will have on their developing bodies. We do have a clue about the developing brain because we've seen research for years on how substances impact the developing brain of youth, and we're seeing those patterns with vaping as well, very closely related to how smoking impacts the developing brain.
Right, got you. And those lungs too. I mean, that's the big thing, right?
Yeah, the lungs and the brain are the big thing. Anytime you inhale something into your lungs that isn't oxygen or a medication, then you're potentially doing damage to your lungs. So, giving people the chance to have the healthiest and best experience in their life means that, not vaping. Our tagline for these campaigns is, a healthy me is vape-free. A healthy me is alcohol-free. A healthy me is whatever the substance free, right? So our kiddos, we want to give them the best chance of being the best version of themselves that they can be, and that means staying away from these substances.
Very good, and that is a great way to end our conversation this morning with those words, and something to remember as we go forward. So thank you both for coming in this morning and talking with me about the work that you all do with the San Juan County Partnership. Again, we will remind everybody about the community listening session today, this afternoon, beginning at 3 o'clock at the San Juan County Partnership offices there on 20th Street, 1515 East 20th Street, and it's about upstream approaches to violence and injury prevention.
Thank you so much, Scott.
You bet. Thanks for being here, both of you. Good to see you. My guests from the San Juan County Partnership here on KSJE. KSJE and the San Juan College Native American Center present the Student Study Tip of the Week.
Hi, this is Marianne coming to you with your Study Tip of the Week. Switch up your study spots. Studying in the same spot can get tedious, so why not mix it up and get a new perspective on things? College campuses have tons of study spots for students. From the library to the campus lawn to local cafes. Think back to studying with friends and finding an area to set up for an hour or for the day. Take advantage of these study areas, both indoors and outdoors, and give yourself a new view every day.
The Student Study Tip of the Week is presented by the San Juan College Native American Center and KSJE.